My name is Vikash Goyal. I'm the CTO at Centerline Biomedical and the lead inventor of the founding technology. What we've developed is a modern, state-of-the-art way to navigate. It lets a surgeon see what they're doing in color, in 3D, with multiple viewpoints with visual aids. It's like Google Maps for your arteries. So we're all familiar with GPS. It's this technology that lets us know exactly where we are anywhere in the world. So under the table in the operating room, we have this array of antennas, and these are like the satellites that are in orbit. So each of them is sending out signals. And then on our tools, like the catheters and guide wires that go inside the patient, we have little receiving antennas. So these are like the antennas in your car or in your cell phone. When we process the signals that come through there, we can figure out exactly where the patient is because we put a tracking marker on them. We can figure out exactly where all our tools are. And then we combine that with our special 3D modeling algorithms to provide the navigation.
During this patient simulation, you will see a catheter and wire combination used to perform a renal angiogram. The wire travels from the femoral artery to the abdominal aorta, to the level of the right and left renal arteries. One of the pitfalls of performing an angiogram at the top of the abdominal aorta is the close proximity of 4 to 5 major vessels in that small region. Just above the left and right renal artery is the celiac trunk, along with the superior mesenteric artery. Using the fluoroscopy method, a physician could accidentally cannulate any one of these vessels, which increases the risk of damaging a vessel that was not intended to be studied. Also, it increases the patient's radiation dose, as well as their contrast dose. The IOPS system allows for a 3-dimensional view of the position of the catheter and wire at all times. The heads-up display allows a physician to see in a lateral plane, an anterior plane, as well as a superior to inferior plane, down the barrel as it were. At your top left, you can see the perfect circle is the opening to the right renal artery. You can see the catheter is right at the opening of the right renal artery. See a wire protrude out from the catheter and go directly into the renal artery, and there you can perform an angioplasty, a stenting, or even an embolization.